Understanding GIP and GLP-1 drugs. Mounjaro versus Ozempic. Managing diabetes effectively often involves exploring various treatment options, and two of the most talked about medications in this field are GIP and GLP-1 receptor agonists. Mindful Diabetes Inc., through its Pathways to Wellness series, is dedicated to providing comprehensive insights into these treatments to help you make informed decisions about your health. GIP, gastric inhibitory polypeptide, and GLP-1, glucagon-like peptide 1, drugs have revolutionized diabetes management by targeting different mechanisms to regulate blood sugar levels. Among these, Mounjaro, tirzepatide, and Ozempic, semaglutide, have emerged as leading options. This blog will delve into the differences between these drugs, their pros and cons, and provide recommendations for their use. Additionally, we will explore how integrating regular exercise can enhance the effectiveness of these treatments. GIP, gastric inhibitory polypeptide, mechanism. GIP is a hormone secreted by the small intestine in response to food intake, particularly glucose and fat. Its primary role is to stimulate insulin secretion from pancreatic beta cells. GIP acts through its receptor, GIPR, which is present on beta cells. Upon binding, GIP triggers intracellular signaling pathways that lead to increased insulin release. Benefits. 1. Enhanced insulin response. GIP enhances the insulin response to meals, which helps in lowering blood sugar levels after eating. 2. Blood sugar control. By facilitating insulin secretion, GIP contributes to glucose control postprandially, after meals. Considerations. 1. Limited effects beyond meal times. GIP's insulinotropic effect is primarily meal-dependent, which means it has less impact during fasting periods. 2. Potential for overstimulation. In conditions like obesity and type 2 diabetes, there can be a diminished response to GIP, reducing its effectiveness in controlling blood sugar levels. GLP-1, glucagon-like peptide 1, mechanism. GLP-1 is an incretin hormone produced by intestinal cells in response to food ingestion. It acts on GLP-1 receptors in various tissues, including the pancreas, brain, heart, and gastrointestinal tract. GLP-1 enhances insulin secretion from pancreatic beta cells in a glucose-dependent manner, meaning it stimulates insulin release when blood glucose is high, suppresses glucagon secretion, which reduces liver glucose output, and slows gastric emptying. Benefits. 1. Improved insulin secretion. GLP-1 receptor activation increases insulin release from pancreatic beta cells, helping to control blood sugar levels. 2. Weight management. Slowed gastric emptying and promotion of satiety contribute to weight loss in individuals with obesity. 3. Cardiometabolic effects. GLP-1 receptor agonists like semaglutide have shown cardiovascular benefits, including reduced risk of major adverse cardiovascular events. Considerations. 1. Gastrointestinal effects. Common side effects of GLP-1 receptor agonists include nausea, vomiting, and diarrhea, which can affect tolerability. 2. Injection site reactions. Since GLP-1 agonists are administered via subcutaneous injection, local reactions may occur. 3. Long-term safety. Continuous assessment is needed for potential effects on pancreas health, although evidence suggests a generally favorable safety profile. Mounjaro, tirzepatide, mechanism. Tirzepatide is a dual GIP and GLP-1 receptor agonist. It combines the mechanisms of both hormones, enhancing insulin secretion from beta cells, suppressing glucagon secretion, slowing gastric emptying, and promoting a feeling of fullness. Benefits. 1. Improved glucose control. Dual agonism of GIP and GLP-1 receptors leads to significant reductions in blood sugar levels, both fasting and postprandial. 2. Weight loss. Like GLP-1 agonists, tirzepatide aids in weight reduction due to its effects on appetite and satiety. 3. Potential cardiovascular benefits. Early studies suggest cardiovascular benefits, although further research is ongoing. Considerations. 1. Gastrointestinal side effects. Nausea, diarrhea, and abdominal discomfort are common with tirzepatide, affecting initial tolerability. 2. Pancreatitis risk. Monitoring for signs of pancreatitis is crucial due to the hormonal effects on pancreatic function. Ozempic, semaglutide, Mechanism. Semaglutide is a GLP-1 receptor agonist that mimics the effects of naturally occurring GLP-1. It enhances insulin secretion, suppresses glucagon release, and slows gastric emptying. Benefits. 1. HbA1c reduction. Semaglutide significantly lowers HbA1c levels, reflecting improved long-term blood sugar control. 2. Weight reduction. It supports weight loss efforts, which is particularly beneficial for patients with obesity and type 2 diabetes. 3. Cardioprotective effects. Semaglutide has been shown to reduce the risk of major cardiovascular events in clinical trials. Considerations. 1. Gastrointestinal symptoms. Nausea, vomiting, and diarrhea are frequent early side effects that may decrease over time. 2. Long-term safety. Ongoing research is needed to assess the effects on pancreas health and other long-term safety considerations. In summary, GIP and GLP-1 play critical roles in glucose metabolism and are targeted by medications like tirzepatide and semaglutide to improve diabetes management and overall metabolic health. These drugs offer significant benefits but require careful consideration of potential side effects and monitoring for long-term safety. Comparing Mounjaro and Ozempic. Effectiveness and outcomes. Blood sugar control. Both Mounjaro and Ozempic are highly effective in lowering blood glucose levels, with Mounjaro showing slightly greater efficacy in some studies. Weight loss. Both medications aid in weight loss, with Mounjaro potentially offering more significant results due to its dual mechanism. Cardiovascular benefits. Ozempic has well-documented cardiovascular benefits, while Mounjaro's potential in this area is still being explored. Side effects and tolerability. Gastrointestinal issues. Both drugs can cause nausea and gastrointestinal discomfort, though these effects are generally manageable. Pancreatitis risk. Both medications carry a risk of pancreatitis, necessitating monitoring for symptoms like severe abdominal pain. Key takeaways. Informed choices. Choose the medication that best aligns with your health goals and lifestyle. Holistic approach. Combine medication with regular exercise for optimal results. Ongoing support. Stay connected with healthcare providers and support communities for continuous guidance. Recommendations for use. Selecting the right medication. Individualized treatment. The choice between Mounjaro and Ozempic should be based on individual patient needs, considering factors like baseline blood sugar levels, weight management goals, and cardiovascular health. Medical guidance. Consult with a healthcare provider to tailor the treatment plan, taking into account medical history and potential drug interactions. Integrating exercise for enhanced results. Synergistic effects. Regular physical activity can amplify the benefits of GIP and GLP-1 drugs by improving insulin sensitivity and promoting weight loss. Exercise recommendations. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking or cycling. Include strength training exercises twice a week to enhance muscle mass and metabolic health. Conclusion. In summary, both Mounjaro and Ozempic offer promising benefits for diabetes management through their unique mechanisms involving GIP and GLP-1. By understanding the differences and considering individual health needs, patients can work with their healthcare providers to choose the most suitable option. Additionally, incorporating regular exercise into the treatment plan can further enhance the effectiveness of these medications. Mindful Diabetes Inc. is committed to empowering individuals with diabetes through the Pathways to Wellness series, offering valuable insights and practical advice for optimal health management. Key takeaways. Informed choices. Choose the medication that best aligns with your health goals and lifestyle. Holistic approach. Combine medication with regular exercise for optimal results. Ongoing support. Stay connected with healthcare providers and support communities for continuous guidance.